Alright, in this group we have Austin Harris and Richie Lane. The female athlete triad is a health concern for active girls and women who are driven to excel in sports. It involves 3 distinct conditions that are all interrelated: disordered eating, which is a range of poor nutritional behaviors; amenorrhea, which is irregular or absent menstrual periods; and osteoporosis, which is low bone mass and microarchitectural deterioration, which leads to weak bones and risk of fracture.
There are many warning signs for eating disorders. Excessive leanness or rapid weight loss is one of them. Avoiding team meals or things like that because they're conscious. Wide fluctuations in weight, so if they're going, the weight's changing rapidly over a big amount. Daily vigorous exercise in addition to regular training sessions, because they feel they need to be thinner or of a smaller build. Stress fractures, like microfractures in bones that may progress to complete fractures. Yellowing of the skin, soft baby hair on the skin. Frequent sore throats despite no other signs of respiratory illness. Self-induced vomiting is part of that. Fatigue, lightheadedness or dizziness, and depression or low self-esteem. They're all warning signs for eating disorders. So if somebody has 2 of these signs, it's a good chance they have some form of eating disorder.
And some of the signs and symptoms for, I don't know how to pronounce it, amenorrhea is an unbalanced diet, an inadequate caloric intake relative to exercise level, and excessive training may predispose females to menstrual abnormalities. Also, the signs and symptoms for osteoporosis would be low estrogen levels and other hormonal changes with accompanying irregular or absent menstrual periods, especially in their teens and 20s when bone mass is accumulating for females.
There's many health consequences for these. A lot of medical complications involve the CV system, the reproductive system, the skeletal, the renal and the central nervous system can all be affected. And women can become infertile due to the absence of ovarian follicular development. Recovering, they may not ovulate before their means are restored, resulting in unexpected pregnancy if a reliable form of birth control is not utilised. So if the right form of birth control isn't used, there's a higher risk that they can become pregnant when they shouldn't.
Some strategies for promoting a healthy body weight. Well, pretty much strategies against any of these would be if the individual refuses, the concerned coach or friend or parent or whoever is concerned should consult a physician directly, and treatment of the triad often requires intervention via team approach, including a physician or a nutritionist, a psychologist, and you need to support from their family and friends to do this, to try to beat these symptoms. And if you are suffering from this, it is important that you have support from those people. And
That's it.
that is our video.